Some good news in the battle of the bulging bellies. Childhood obesity may be starting to reverse. Wall Street Journal's Betsy McKay joins us now to explain. Betsy, always love good news.
Yeah, it is good news for once. This has been, obesity rates in this country and childhood obesity has tripled in the past, since the 80s. It's really been climbing for a long time. It's plateaued. And now this is a kind of an initial sign that things are starting to turn in the other direction for very young children.
We're talking about children 2 to 5 years old. 1 in 8 children is considered obese in that age group.
Right. It's 2 to 4 years old, and this particular group are low-income preschoolers. So they were children who were measured in a data set that includes children who are in the WIC program for low-income families. So it's a very specific age group, but they're considered, specific income and age group, but they are considered particularly vulnerable to high obesity rates. Those are the children who have the highest rates.
And we do know that as a society, and a lot of Western societies, not just the US, obesity is becoming an increasing problem, leads to a lot of associated health problems. Do we know why this is perhaps beginning to turn the corner? And if we do, can that be extrapolated to everyone else?
Well, just with same as with the rise of obesity, people debated what the causes were. People have People have questions about what's causing the turnaround, and probably the answer is a number of factors. The CDC today cited 3. One is changes in the WIC program to promote healthier foods, more fresh fruits and vegetables, more low-fat milk rather than fatty milk, and so forth. And then breastfeeding policies that make it easier for women to breastfeed in childcare centers to give their kids a healthy early start. And then, community programs. They cited Michelle Obama's Let's Move grassroots campaign, but every community, if you look, has some sort of anti-obesity initiative, and there's just a general growing awareness of the dangers of obesity. And some people say, look, you just can't help starting to make changes when you've got people all around you talking about eating healthier.
Now, one of the things, and this doesn't relate to kids, but one of the things here in this city a few years ago is for chain restaurants, they had to put an estimate of the calories in things. And it always surprises me is with sort of 2 identical looking things can have very different calories. That certainly puts it front and center. Do I really need to have something that's, very fatty, right?
Right, exactly. Once you become aware of it, then you think twice. You still want that big bowl of ice cream at night and so forth, but if your environment is making it harder for you to eat such foods, then by definition you do it less. But one of the things that is most interesting in this whole field is that it's very hard to measure and pinpoint what's causing what. There aren't a lot of studies that have been done of the effects of some of these programs, and so that's a whole area that needs to be developed.
Well, it sounds like it's going to keep someone very busy for a while. Thank you very much, Betsy McKay of the Wall Street Journal. We appreciate your time.